Are you consistently thirsty or really, really hungry? Or maybe you're just so tired that you might pass out? Well, if that's you, then you have diabetes 1.
Oh.
But don't worry, there are plenty of ways to manage and maintain your life with diabetes 1.
Want to spread awareness about diabetes 1. Diabetes 1 is when the pancreas in your body does not function properly. The insulin that would be created in the pancreas is not created at all, or there's a little amount of it. It does not get injected into the bloodstream, so the cell cannot produce energy, and from the glucose in the bloodstream, it's useless. I've been struggling with diabetes 1 for my whole life. I was diagnosed when I was about 2 years old, so I was pretty young. But daily I have to inject myself daily with insulin pens so that my bloodstream gets the insulin needed. So I have to cut down on sugary foods like this.
I love sweet tart. Stop eating that sugary treat.
The first career that could be of assistance to a diabetic is a dietitian. They translate scientific information about nutrition into practical advice to help people make health-conscious decisions about food. They set up meal plans, teach you how to count carbohydrates in your foods, and provide a great support system. The second career is a certified diabetic educator. They are health professionals who possess comprehensive knowledge of and experience in diabetes management, prediabetes, and diabetes prevention. They work with you to develop a plan to stay healthy and give you the tools and ongoing support to make that plan a regular part of your life. The third career is a psychiatrist. They evaluate, diagnose, and treat patients with mental disorders, provide the necessary treatment that matches with their mental health status, and hold discussions for therapy by giving advice.
Now let's go back to Taylor for an exclusive look into the life of a real diabetic patient shown in this interview here.
I'm Megan. I'm in 7th grade. I've had diabetes for 10 years. Yeah.
Nice. So I'm going to ask you a couple questions about your diagnosis and how you maintain and manage your life with diabetes. So how long have you had diabetes type 1? Did you already answer that?
Almost 10 years.
Almost 10 years. Okay. Okay, so when do you check your glucose?
Almost every time that I eat.
Okay. What is your normal glucose level at?
In the 100 range.
In the 100 range. So how do you maintain or manage your diabetes 1?
I use an insulin pump, which
Would you mind showing us?
right here, and it gives me my insulin when I eat or when I need it.
So do you have to use the thing where you check your blood as well?
Yes.
Want to describe that to us?
There's a needle and it pokes me, and then I put blood in a machine and it tells me my number.
Nice. When/what times do you take insulin?
When my number is high or when I eat food.
Okay. About how much insulin do you think you take?
Like 30 units a day.
Awesome. So now we're going to move on to your daily lifestyle/diet. So what do you eat for breakfast, lunch, and dinner?
I can eat anything, so I basically just eat whatever anyone would eat.
Nice. So let me ask you this question. Do you think that living with diabetes 1, you feel like you can live a normal life just like everyone else?
Yeah, pretty much. I just have to make sure that I'm healthy every day.
That's awesome. Okay, do you exercise a lot?
I dance like 5 days a week.
That's good. Do you have any symptoms or complications due to having diabetes 1?
No.
Like, do you ever have blurry vision, weight loss?
Sometimes when my number's too low, I'll get really blurry and shaky and just
And when you feel like you're really low, what do you do to take care of that?
I just eat a lot of candy.
Love that. Okay. Okay, so now let's go on to some basic questions that I feel like a person that doesn't have diabetes 1 to educate them would probably want to know. So how do you feel having diabetes 1, like compared to your other friends that don't have it? Do you feel like you live a different lifestyle than them, or?
I feel like we're basically the same. It's just that I have to do that extra thing. But they all know and they don't really care.
So for how long you've been having it, do you think that you can like manage it a lot easier? Like for example, when you first found out, how did you react? Did you know what you actually had?
I was pretty young, so I don't really remember what it was like. But I feel like now, since I'm older, I can do it on my own without anyone's help.
That's good. Okay, so last question you were gonna ask is, what would be advice that you would give someone else that has diabetes 1, or even people that don't have diabetes 1, what would just be advice to them to either prevent that or deal with it?
Just really care about yourself so that you're not in an area where you're not doing good with your health and your lifestyle.
Awesome. Thanks for thanks for being a part of this. That's pretty much it, and we're out. Okay, so now that I've just got the chance to talk to Megan, patient with diabetes 1, I'm going to talk a little bit about blood sugar monitoring and how it helps people with diabetes. Blood sugar monitoring helps people with diabetes manage the disease and avoid its associated problems. A person with diabetes can use the results of their glucose monitoring to make smart choices about food, physical activity, and medication. For patients with diabetes 1, the most common way to check glucose levels involves pricking a fingertip with an automatic lancing device to obtain a blood sample, and then using a glucose meter to measure the blood sample's glucose level. For Megan, she is to use a tiny sensor inserted under the skin to check glucose levels in tissue fluid called continuous glucose monitoring systems, which requires an insulin pump. Some recommendations for exercise and lifestyle with a person with diabetes 1 include taking control of your health, eating a heart-healthy diet, maintaining a healthy weight, exercising regularly, testing blood glucose levels frequently, and meeting your blood glucose goals as closely as possible. That's it.